Central Valley Today.
Thinning hair and hair loss are problems that are often associated with men, but there are actually many women who are forced to deal with these issues. We're now going to head to the South Valley for a visit with Dr. Daria Majoubi at his clinic to learn about a hair rejuvenation treatment that uses the body's own stem cells to regrow the hair. As our Alex Delgado reports, for a 39-year-old woman named Amy Rose, it was life-changing.
When you're a young girl and you start to lose your hair, you don't want to talk about it, and you don't want people to judge you about it. And now that I've had this done and I've gone through what I've gone through, I specifically tell people about it. I'm like, check this out. Look at my pictures. Look at my before pictures. Check them out. You know, because there is life after death.
Tell me about Amy. When she came into your office, she was just at a loss. She didn't know what to do.
Yeah, so Amy came in, and for her age, she had very thinning hair.
She was young, right?
Yes.
Yeah.
Yes.
She's
in her 30s.
In her 30s. Mm-hmm.
Yeah. And so she told me that she's been losing her hair for the past few years, and it looked pretty thin. So we talked about the different treatments, and then we started the treatment on her. And she responded really quickly, actually. Some patients respond quicker than others. If you've had hair loss for a long time, usually it's a slower start, but everybody does respond. It's just that some people need more treatments and some people need less.
Tell me about this procedure that you have.
So it's a PRP treatment in combination with stem cell treatments.
What's PRP?
So PRP is platelet-rich plasma. Mm-hmm. So we draw the patient's blood, and we concentrate the platelets, usually about 5 to 6 fold from what's found in the blood. So the platelets have all the growth factors, and it stimulates the resident stem cells within the hair follicle to grow. So a lot of these hair follicles are in the dormant stage that aren't in their growth phase. So what we do is we give platelet injections to kind of kickstart them into the growth phase.
Mm-hmm. What do you think accounts to hair loss? What causes it?
So usually stress causes it. Also, there's a dihydrotestosterone that the DHT that the body produces, and there are receptors at the bottom of the hair follicle, especially in the crown area, that has those receptors, and it decreases the circulation to those hair follicles, and the hair follicles get smaller, and you lose your hair.
Do all of those products that claim hair growth work?
Not all of them.
Yeah.
I think that sometimes they just prey on people's desperation.
I mean, I was trying, you know, hair growth pills. I was trying, yeah, I mean, everything. Trying to sleep more, de-stress.
Once it starts to grow, then they have to keep the hair cycle in its growth phase. So they have to come in maybe every 6 months or every year to get just a retreatment. But for the people that it does work on, it's amazing.
How long are the treatments, and how much time before someone notices a difference in their hair?
So usually it takes about anywhere between 3 to 6 months to see a difference from each treatment. Now, not all PRPs are the same. There are other doctors that do PRPs. They don't use a high concentration system. I use a very high concentration system, and I've been doing it for about 4 years now, so we really perfected the system. We do PRP with microneedling, and then we do stem cells, and it's all about how you inject and how deep you go into the tissue when you do the microneedling.
We really just started to see just hair growth. I mean, it was really amazing, like where, especially my temples, like right here, like this was just completely, pretty much bald. Yeah. And now it has like little baby hairs all over. It's almost like when I touch it, it's similar to how I felt like when I was a kid.
What's the recovery time? And for those people that are watching are probably thinking, is it painful? Is it not painful? Tell us what to expect.
So the procedure is not painful. I initially do a nerve block. So we block the nerve that goes into the scalp. And once I start injecting, there's usually no pain. The recovery time, the next day they could go to work.
Wow. I thought, who is this guy? Like, this guy, is this probably like a witch doctor type of thing, or what is he all about? And when I met him, you know, his heart and his kindness and how nice he was to listen to me, he's just a very touching man, yeah. When you look at yourself in the mirror, you're thinking to yourself like, wow, okay, like this is what I'm just gonna have to deal with forever. And then, you know, you go out on a limb and you trust something and it works out.
Well, it sounds pretty life-changing, and it's proven to be life-changing for Amy. So you're doing great things here as usual. Can people come in for a consultation, and how do they do so?
Absolutely. They can come in if they have health insurance. It's you know, the health insurance usually covers the. If they have, if they don't have health insurance or their insurance doesn't cover it, it's $125 for a consultation.
Got it.
If they decide to do the procedure, the price of the consultation will be credited to the procedure.
As always, good talking to you, Doctor.
Thank you.
Yeah, you're doing great things here in the South Valley and for the entire Central Valley. Thanks again.
Thank you.
Okay.